We all hear about data being the next big thing in healthcare, right?
Yeah.
Promising all these breakthroughs and personalized treatment.
Absolutely. It's talked about constantly.
But have you ever actually wondered what this mountain of health data really looks like? Behind the scenes, it can feel a bit like this impenetrable fortress of numbers and jargon.
Oh, it absolutely can feel that way. Yeah. And that's really why getting a handle on how this information is structured is, well, so important.
Right.
It helps us move beyond just the abstract idea of big data to something more concrete, understanding what's actually being collected.
Okay, let's unpack this then,
Yeah.
because today we're going on a bit of a fascinating expedition. We've managed to get our hands on a clinical research database manual from Taipei Medical University, and it's brand new, dated February 2025.
Fresh off the presses.
Exactly. And our goal today is really to understand the types of patient information being stored and, maybe more importantly, the system they use to organize it all.
Kind of like getting the blueprint.
Yeah, the blueprint to this healthcare data hub.
Precisely. And this manual, it acts like a translator, really, helping us decipher a pretty significant part of the healthcare data story. Gives us the keys,
The keys to unlock the insights. And this isn't just a peek at one hospital's data either, is it?
No, not at all.
This manual is the guide for the clinical research databases for 3 major institutions: Taipei Medical University Hospital, Shuangho Hospital, and Wanfang Hospital. So it's quite a comprehensive overview we're getting.
That's right. Each of these places contributes its data, which creates a much richer, more diverse pool of information for researchers. And this manual is their shared guide for anyone who needs to access it and, well, make sense of it all.
So for you, the learner, the aim of this deep dive is really to take you behind the scenes, a real clinical research database.
Yeah.
We want to shine a light on its underlying structure, focusing on the different kinds of patient data they gather and how it sort of follows an individual's healthcare journey. Think of it as an exclusive backstage tour.
And what's immediately striking, I think, is just the sheer scope of information that's captured. The manual itself is really carefully divided into sections,
Right.
each one representing a major category of clinical data.
Yeah, it's not just some random pile of facts, is it? It's organized logically.
Right.
We're talking big buckets like patient demographics,
Yeah.
The essential details about who the patient
The
is.
basics.
Then there's diagnosis, what health issues they're facing, medication, procedures, and medical orders of the treatments and things they receive. And that's really just scratching the surface.
Exactly. Those are like the fundamental building blocks, but the manual goes much deeper. We also see sections for lab results, image examination and radiology, surgery details, and even more specialized areas like cancer registries, pathology reports, even nursing records. And then there's a kind of catch-all others category too.
It sounds incredibly thorough, like
Yeah.
a complete log of a patient's interactions with the healthcare system.
It aims to be, yes.
And within each of these main categories, you mentioned there are numerous data tables, or they call them files sometimes in the manual,
That's right, files or tables.
each dedicated to specific types of information. So when we say data table, are we basically talking about something like a big detailed spreadsheet, organized with rows and columns for different bits of info?
That's a perfect analogy, actually, yeah. Think of a very detailed spreadsheet. Each row is a specific event or piece of information, and each column is a different attribute or data point about that event.
Okay.
So let's take patient demographics as an example. Within that category, there's a table called CHR Basic. That holds the fundamental patient info.
Okay, CHR Basic. What kind of key details will we find in there, like the really core stuff?
So this table has the core identification for a patient in the system. It includes their unique medical record number, which is encrypted, importantly, for privacy.
Crucial.
The specific hospital they're linked to, details like their birthplace. And what's particularly interesting is a field labeled Yuiwui, that's Cha Hu Bingli, which translates roughly to extra thick medical record. It's also flagged as more flag. This might point towards patients with really extensive medical histories,
Okay. That makes sense. A flag for complex cases.
Potentially, yeah. And this table alone, CHR Basic, contains over 5.5 million records across the 3 hospitals.
Wow, 5.5 million. That's a vast amount of history just in the basics. And it's not just the absolute basics, right? There's also NDR case. What's that about?
Right, NDRK stands for the Death Registry. This table, which has data up to December 2022, contains over 330,000 records. It holds the patient's encrypted ID, their birth date, sex, and crucially, the date and cause of death. And that's classified according to the Ministry of Health and Welfare standards. This kind of data is, well, essential for understanding mortality trends.
Sobering, definitely, but absolutely vital information for public health research, and the demographics section keeps going. We also have BIOINF for physiological measurements.
Yes, BioINF captures things like temperature, pulse, head circumference, waist circumference, recorded during outpatient and inpatient visits.
Okay.
But interestingly, the manual actually points you to a separate table, CHR figure, for height and weight.
Oh, right.
And another one, CHRBP, just for blood pressure readings. So it shows how related data points are sometimes stored in different but linked tables.
Distributed but connected.
Exactly. And BioINF itself has over 22 million records up to June 2023. Just highlights how often these basic measurements are taken.
22 million. Then we have CHKKZ for long-term health checkups, CHR figure specifically for height and weight, CHRBP for blood pressure. It's really granular. And even CHROBS for observation periods, and COVID-CR for COVID-19 screening.
Yeah.
That last one really shows how the database can adapt, doesn't it?
Yeah.
Capturing info about new health concerns like COVID.
Absolutely. CHROBS is particularly insightful. It compiles observation periods based on all sorts of encounters, visits, surgeries, meds, labs, exams. It gives researchers a kind of longitudinal view of a patient's engagement over time.
A timeline almost.
Sort of, yeah. And COVID-CR, with over 360,000 records from mid-2020 to mid-2023, just illustrates the database's ability to respond to public health crises, recording PCR results, rapid tech results, that kind of thing.
Okay, now moving to diagnosis. We see tables like OPD Basic and IPD Basic. Those sound pretty fundamental, like the cornerstones.
They really are foundational, yeah. OPD Basic covers outpatient visits. IPD Basic covers inpatient stays. These tables are the central place for the diagnoses a patient gets during those encounters.
And the scale.
Well, OPD Basic alone contains a staggering 72 million records up to the end of 2023.
72 million, just for outpatient.
Yep. It's enormous, really highlights the frequency of outpatient care and gives this incredibly rich data set for studying common illnesses, treatment patterns in the community.
Wow. That really puts the scale of patient interactions into perspective. And within diagnosis, there's also CRISI for inpatient disease classification, CHRD-IAG for inpatient diagnoses, even CREXT for external causes of injury, like accidents.
Exactly. Things like accidents, injuries, and EPDHIS for emergency visits, too. It looks like they're capturing diagnostic info from, well, pretty much every angle.
And the manual mentions an update to include ICD-10 codes. What exactly does that mean for the data?
ICD-10. That's the 10th revision of the International Statistical Classification of Diseases and Related Health Problems.
Right.
Think of it as the global standard, a standardized system for coding diagnoses. Moving to ICD-10 allows for much more specific, much more detailed recording of medical conditions.
Which is better for research.
Crucial for accurate research, yeah. Also for statistical analysis, even billing. And that table, CURE-ICD, with over 1.5 million records, really focuses on this classification side. It's often used in processes like DRG coding.
And DRG, that rings a bell. That's related to how hospitals get paid, right? Reimbursement.
Exactly. DRG stands for Diagnosis-Related Groups. It's a system used to categorize hospital cases into groups that use similar resources and have similar costs. So accurate ICD coding in that CRISI table directly impacts how hospitals are reimbursed for inpatient care. It's important for the financial side, too.
Got it. Okay, moving on to medication. Looks equally comprehensive. There's OPD Med for outpatient and emergency meds.
Right.
Op Warning 2 for drug allergies. That sounds incredibly important for safety.
Oh, absolutely.
Pre-fill med for continuous prescriptions, and then you'd order and you'd order log for inpatient medication. It covers the whole spectrum.
Medication data is absolutely vital, you're right. And these tables reflect the different ways meds are prescribed and given out. OPDMD, get this, has over 164 million records.
164 million.
Yeah. Gives you a sense of the sheer volume of outpatient prescriptions. Op Warning 2, as you said, critical for safety, tracking known allergies. Refill Med is newer, covers 100 chronic diseases, highlighting that focus on long-term conditions.
Right.
And then you'd order and your order log meticulously track inpatient meds, from the doctor's initial order right down to the detailed log of when it was actually given to the patient.
It's just amazing how much detail they capture, down to allergies and refills for chronic stuff. Okay, Then we have procedures and medical orders, mainly in OPDFE and IPDFE. These seem to go beyond just medications.
Yes, exactly. While OPDMed and UDorder focus specifically on drugs, OPDFE and IPDFE capture the details and, importantly, the billing info for a huge array of outpatient and inpatient procedures, tests, medical orders.
So everything else, basically.
Pretty much everything from a routine blood draw to complex surgery or an advanced imaging scan. These tables are essential for understanding how healthcare resources are used and, the costs involved.
Makes sense. And the laboratory section, it looks like it's structured differently depending on the hospital.
Ah, yes, good catch.
There's UpDexper and LabResult for Taipei Medical University Hospital and Shuangho Hospital, but then Exporter and Xpercent for Wanfang Hospital. That's interesting. Why the difference?
That's actually a pretty common situation in healthcare data management. Often, different hospitals have kind of evolved with their own unique legacy systems, right? Different workflows.
Right, historical reasons.
Exactly, which can lead to variations in how their databases are structured. The manual acknowledges this by giving separate, detailed descriptions for each hospital's lab data tables, including the bacterial reports in Baxi and Experbact.
So it makes combining data trickier.
It does. This heterogeneity, while common, definitely presents challenges for researchers who want to combine data across institutions. It really underscores the need for data harmonization efforts down the line.
Gotcha. Okay, then we have image examination and radiology. There's LabShe for scheduled exams, CardiaSec report specifically for heart ultrasounds.
Oh, very specific, yeah.
And then general radiology orders and reports in OPED X-ray and RAD report. Surgery gets its own section too, OB Basic and CHROP. And then we get into cancer, pathology, nursing records. The level of specialization is just remarkable.
It truly is. The cancer section, for instance, it includes a table for the Central Cancer Registry, that's CRTKAC, plus detailed info on chemomeds, any side effects recorded, treatment outcomes, cancer staging, the morphology of tumors, and even very specific treatment plans for lung and breast cancer. Pathology has PathReport for the detailed analysis of tissue samples. And nursing records mainly focus on those crucial vital signs and NSTIPR. Each section is like a deep dive into a specific critical aspect of patient care.
It's clear this isn't a static document either. I noticed that section V215, Insurine, Vierdinjek, that's it, version 2.15, change history.
Right. It looks like they're constantly updating and refining this database.
Absolutely. The needs of data collection and research, they evolve over time, right? So the databases have to keep up. Version 2.15, for example, includes updates to how billing and order numbers are formatted, making them more consistent.
Okay.
And importantly, it also mentions removing personally identifiable information PII fields, like the national ID number, sex type, birth date from certain tables.
Those ones.
Like IPD Basic, some of the cancer plan tables, very likely to enhance patient privacy.
That's a really significant point about privacy. It's actually reassuring to see that being actively addressed in the updates.
It is.
And it looks like version 2.14 saw a huge overhaul, 47 tables updated.
Yeah, that was a big one.
And they even introduced new tables like Refill Med, that breast cancer treatment plan table, plus DIS Basic and DIS SDTL for discharge summaries.
That's right.
That really gives a sense of the ongoing development and just the scale of these changes.
It does indeed. These updates, they reflect shifts in clinical best practices, maybe evolving reporting requirements, and definitely that growing emphasis on data privacy and security. The addition of the discharge summary tables, DIS Basic and DTL, that's particularly valuable for researchers looking at the whole patient journey and, what influences outcomes after hospitalization.
Right, the full picture. The manual also mentions Jianyan Longwei. That translates to primary key fields, right? In tables like CHR Basic and OPD Basic. What's the deal with primary keys? Why are they important?
Oh, primary keys are absolutely fundamental to how these databases are organized and how we can reliably get information out. Think of a primary key as the unique identifier for each and every single record within a specific table.
Like a unique ID number.
Exactly. It ensures that each patient encounter or each piece of info can be precisely and uniquely identified, and crucially, linked to other relevant data across different tables.
Ah, so that's how they connect things.
That's the mechanism. For example, in CHR Basic, it's likely the combination of the patient's medical record number and the specific hospital ID that serves as the primary key. Make sure no two records are identical. Like the unique number on your driver's license, make sure there's no confusion.
Got it. And for each table, there's a UNEJR section, Zilia Miyashu, meaning data description. That outlines which hospitals are included, the time frame of the data, the number of records. That seems incredibly useful.
Oh, absolutely crucial. This metadata, as it's called, is vital for anyone planning to use the database for research or analysis.
Why is that?
Well, knowing the specific timeframes, knowing the number of records available, it helps researchers figure out what kinds of questions can actually be reliably answered using the data they have. It sets the scope.
Right, manages expectations. Yeah. Okay, now, moving beyond just the individual tables, the manual also includes Kokajan Linchuangzilier Guanian 2, Appendix 1, Clinical Data Relationship Diagram. Sounds like it visually shows how all these different tables connect.
Exactly right. These diagrams are like a visual roadmap,
Yeah.
showing the relationships between the various data tables.
Can you give an example?
Sure. There's one diagram showing the connections between CHR Basic, Cheat Kasi, Sure Figure, and CHR BP. It clearly shows how the basic patient demographics in CHR Basic link to their long-term health checkup data in CHR KC, their height and weight in CHR Figure, and their blood pressure in CHR BP.
Ah, okay. You can literally see the links.
Yep. This interconnectedness is absolutely key to getting that comprehensive, holistic view of a patient's health journey.
So it's definitely not just a collection of isolated digital spreadsheets then. There are these deliberately built links between them.
Correct. That's what makes the data so powerful for analysis.
These defined relationships allow researchers to follow a patient's journey across different types of encounters and connect seemingly separate pieces of info, like linking a diagnosis to the meds, the procedures, and the eventual outcomes.
Precisely. It enables much more sophisticated questions to be asked.
Okay, and finally, the manual includes Ziwolde die Erbufen, Canazilia, Part 2, reference materials. And within that, Section 12, Code Definition. Chanzabang Yi. That sounds like the dictionary, explaining all the codes and abbreviations used in the tables.
Yes, this is basically the decoder ring for the data. It's where you find the detailed meaning behind all the various codes used throughout the tables.
So, like,
For example, this section would tell you that if you see code type AIR5 in the CHR basic table, that specifically means the patient's place of birth.
okay. So it's the key that unlocks the meaning behind all the shorthand they use in the database.
Exactly.
And it covers all sorts of codes, procedures, diagnoses, using both the older ICD-9 and the current ICD-10 systems.
Yep. Medications, lab tests, even hospital-specific codes like bed numbers, department codes. Also, codes identifying healthcare professionals, like doctors.
So it creates a standardized language within the whole database system.
That's precisely right. These carefully defined code definitions ensure consistency. They enable standardized analysis across the entire dataset. Without this section, honestly, interpreting the raw data accurately would be incredibly difficult, maybe impossible.
Okay, so as the learner, taking all of this in, what are some of the key practical implications here, the real aha moments that stand out from seeing this structure?
Well, I think the first major aha moment is truly grasping the immense complexity and the sheer level of detail involved in collecting and organizing clinical data systematically. A single patient encounter, what seems like a routine doctor's visit, can actually generate tons of data points. And those points are then carefully recorded and stored across multiple interconnected tables, each one capturing a different facet of that single interaction.
It really paints a vivid picture, doesn't it? You start with that initial outpatient visit in OPD Basic.
Right.
That might lead to some lab tests with results in lab result, a prescription logged in RPD-MD, maybe a follow-up appointment scheduled. It's all connected in this intricate web.
Exactly. You start to see how researchers can piece together a much more comprehensive, more nuanced picture of a patient's entire healthcare journey, but skillfully linking these seemingly separate data points.
Yeah.
And the inclusion of specific data, like the COVID-19 screening results in COVID-SCREE, that clearly demonstrates how these robust databases can adapt. They can expand to effectively capture critical information about new and emerging public health threats.
So to kind of bring it all together then, this deep dive into the Clinical Research Database Manual, it's revealed this highly structured, incredibly detailed system for collecting and managing patient health information.
Yeah.
It covers everything from the basic demographics to very specific diagnoses, meds, procedures, lab findings, even specialized areas like cancer care and nursing notes.
Yes, it's really a testament to the significant effort and, frankly, expertise required to build and maintain such a valuable resource, a resource for advancing medical research and ultimately for making better, more informed decisions that improve healthcare outcomes for all of us.
Definitely. Now, As we wrap up this fascinating exploration, it's important to pause for a second, isn't it, and reflect on the sheer scale and interconnectedness of all this health data. Thinking about the vast amounts of personal information held in these databases, and remembering the manual's notes about removing PII for privacy. What other thoughts or maybe questions does this glimpse behind the curtain spark for you, the learner? The ongoing evolution of healthcare data and its potential impact on our lives.